going to wait just a couple minutes while other folks trickle into the meeting. We'll get started probably at about 11:02. All right, so what I'll go ahead and do is get things started, and if other folks join, that's perfectly fine. There's a little bit of background information that we share before we jump into the rules anyhow. So let's get it started. Just a heads up that this meeting is being recorded as part of the public record. All right, so first and foremost, on behalf of the Oregon Health Authority and the Temporary Healthcare Staff Rate Setting Program, I want to take this opportunity to thank you guys, or you all, for taking time out of your days to provide insight on our continued development of the rate setting program outlined in House Bill 2665 and passed in the 2023 legislative session. My name is Joe Sullivan, and I'm the manager of the Temporary Healthcare Staff Rate Setting Program. I'll be co-facilitating this session with my colleagues Rodney Manelis, who's a policy lead, and Shelley Huber, our implementation lead. Additionally, our project manager, Claire Schultz, and our research analyst, Brian Lothrop, are here. Again, we appreciate you taking the time out of your schedules to discuss the rules we continue to refine as we attempt to establish rules that uphold the intent of the legislation and creates a program that effectively serves those adhering to the requirements of the bill. The reason we hold these RACs is to hear from folks who are going to be impacted by the legislation. But before we jump into the rules, let's review a few things. We'd like to uplift the following participation guidelines and ensure we have shared understanding regarding how this meeting should function. We'll be asking folks to raise their virtual hands when they'd like to speak. The raise hand icon is located in the menu bar at the bottom of the Zoom screen. Staff will keep you muted until you are called on by one of the facilitators. We'll also ask folks to be respectful of the time we have allocated for each agenda item, which program staff will ensure we adhere to. Additionally, you'll all be provided a link to a smart sheet that will allow you to submit any feedback you are unable to share during this live meeting. We'll deliver the link to the form at the conclusion of the meeting, and we will be disabling the form 24 hours after the meeting end time. It's important the feedback is received during that window to be considered part of this engagement process. We hope this all allows for a smooth conversation and input to be received and considered. There's also a public comment period that begins in October of this year. I ask folks to please remember that all opinions are valid. While we may not align on all things, it's important we avoid argument or commenting on the validity of other statements, and opposition should be expressed in a respectful manner. Lastly, I ask that you acknowledge and respect power differences. We all don't hold the same level of influence, let alone during this RAC process. So some of you may be asking, what is a rule advisory committee? So as part of the rulemaking process, when possible, OHA can appoint an advisory committee to support updating rules. The committees include people like yourselves that are affected by the legislation and would meet with the division to discuss and give feedback on the proposed rules. A RAC includes an overview, review of the draft rule language proposed by OHA, as well as an opportunity for you all to provide feedback and guidance on the draft rules. A RAC does not include discussion of the validity, efficacy of the legislation, or an opportunity to change the House bill. As part of your role as a RAC member, we expect folks to have an opportunity to provide feedback on the draft text and offer suggestions to improve the implementation of the program. We ask that folks pay special attention to timelines and industry jargon as we move through this process. Therefore, our goals for today are to review the draft text, identify changes in language to increase shared understanding, and to identify points of challenge for your industry or opportunities for the program to clarify its expectations. So again, a reminder to provide any comments not shared within 24 hours from the end of this session via the feedback form provided at the end of session via email, as well as within the Zoom chat. We are aware that some of you have been asking questions via email, and more will likely arise during this process. In order to provide clarifications on the most commonly asked questions, we'll update our FAQ on the program website. I say all of that to make sure folks know this hasn't been and will not be the last chance you have to share thoughts on the development and implementation of House Bill 2665. We are committed to an iterative process and will continue to show up in front of the impacted parties to receive feedback on our program. Before I hand things off to Rodney, I want to thank you again for your continued commitment to helping us implement a program that meets the needs of those impacted. Here's the program email as well as my contact information for folks who need it, which is also published on the web pages. Rodney, it's all you. You're muted.
There we go. Can you
It's
hear me
only
now?
right. There you go.
There we go. Awesome. So much for my public comment. All right. So thank you, everyone. My name is Rodney Manelis. I serve as the policy lead for HB 2665, Temporary Healthcare Staff Rate Setting Program. For my portion, I'll be walking us through the draft rule edits section by section. Here's how we'll do it. We're focusing only on the tracked edits you see on screen. When there's new language inserted, I'll read the full insertion. When there are smaller changes, like correcting an OIS citation or capitalization, I'll just call those out. After each change, I'll pause briefly so you can share feedback. Please reference your comments using the OAR number and subsection. Just a reminder, today's scope is the rule language on screen. If you have broader program or operational questions, please submit those through the feedback form that will be made available after the meeting, so we can keep this session focused on the rules. With that, let's begin with section 409-039-0010, definitions. The following is an addition. Subsection 4, bill rate means the hourly wage rate plus fees and agency margin charged to the client exclusive of per diem stipends. I'd like to call out here all numbers following the addition of subsection 4 have been updated to maintain numerical order. I want to call out, I'd like to call out subsection 6, certified nursing assistants, CNAs. ORS range corrects reference to ORS 67844 from 2 to 0, 678448. Next, I'd like to call out subsection 16, Indian healthcare provider, IHCP, capitalizes urban and organization. Moving on to subsection 21, per diem stipend, the following is an addition. Per diem stipend refers to an allowance paid to personnel for lodging, meals, and incidental expenses while on assignment that is based on the rates published by the U.S. General Services Administration, GSA. Moving on, the old rate definition has been deleted to avoid conflict with the new bill rate, wage rate definitions. Subsection 28, excuse me, the following is an addition. Wage rate means the following pay rate received by the personnel exclusive of agency margin, per diem stipend, and other supplemental pay. I'll pause briefly here before we move
on. We have a question. Let me unmute. I see the name is E. If you are able to update your name as well in Zoom, that will help us with record keeping, but you're welcome to unmute.
I will change that. This is Eugenia Liu with the Oregon Healthcare Association. My apologies. I will go ahead. So I appreciate what the department or what OHA is trying to do here with the addition of the different terms, but I'm wondering if the concept of a bill rate, it seems very specific to how we are structuring the temporary staffing agency rates. There's comments around agency margin, but typically the bill rate is the total cost that a temporary staffing agency charges to a provider. So it would include, the hourly pay rate, any markups like taxes, benefits, and other things. I'm wondering if by defining it this way to talk about agency margin exclusive of a per diem stipend, that it's going to confuse people and it creates kind of a definition that isn't part, a part of the general way that we talk about a total bill rate or a total bill rate that a temporary staffing agency typically charges. And maybe we think about having three different definitions. Maybe there is a bill rate that is being defined as like the total cost that a temporary staffing agency charges for personnel, which is inclusive of the things that you're referencing, that it's inclusive of the hourly wage rate, it's inclusive of taxes, benefits, administrative, contract, or other fees, and the agency's profits. And then we have a separate definition around max rate, and that's the max rate that the OHA will set, right? That's the maximum bill rate that an agency can charge to or receive from an entity that engages a temporary staffing agency, excluding any agreed upon per diem stipends as defined in these rules. And that way it gives you it outlines what a bill rate typically is, what the max rate is, and then it also gives you that wiggle room to then talk about any agreed upon per diem stipends. And we can talk a little bit more about the definitions around that. And I think that might make it a little clearer as to what all these different rates are.
That's hugely helpful, Eugenia. I know that Shelley's trying to capture things. We're also recording the meeting, so we'll have a record of what you just stated. But could you make sure that you provide your suggestions for those definitions in the feedback form so that we have it in written form from you?
Absolutely. I will definitely do that. And I can talk about, I'll let other folks, I see other hands up, but I do want to address the concept and the definition of per diem too, when you guys are ready.
Why don't you just go ahead and why don't we do that now, Eugenia, while you have the floor, and then we can hand it off to the next person, if that's okay.
Let me see if I can find Eugenia in the list and ask to unmute. There we go. It looks like you're unmuted, Eugenia.
Perfect. So I appreciate the concept of per diem stipends. I know that's probably come up with some of the out-of-state nurses and things like that that are being used by some of the temporary staffing agencies. I think one question that I have is why the existing exception process isn't sufficient to address that. Because I think, there is a maximum bill rate that OHA sets. A per diem stipend seems to be something that the parties can agree to, right? They know that this person's coming from another location and maybe there are travel expenses and living expenses that have to be accounted for. And then that should go through the exception process. So I think preliminarily, the first question I have is why that exception process doesn't work for this piece of it and why we have to kind of change things.
Rodney, you mind if I ask a question?
Yes.
Eugenia, when you refer to the exception process, can you clarify for me?
Yeah, the non-emergency waiver. So I think you have there is a process that's outlined in rule today that says if the parties need to charge something above the max rate that is being set, the parties can apply for that, right? It's agreed upon. Both parties are coming to OHA to say, we have a need, and we've got to charge above the max rate.
So making sure I'm following correctly, in that case, the per diem stipend would be a part of the maximum bill rate.
It would be something that the parties are saying, yep, we have to go above the rate, whatever it may be, right? Like, hey, we've got to pay an additional stipend. The parties have said we can't, operate with the max rates in this particular situation. Can we now charge something above?
Eugenia, can I ask a question?
Yeah.
Yes, Shelley.
Sorry, I don't know if it's just my end that was breaking up or delayed. So I apologize if I talked over anybody. It just froze up for a second. Just to kind of try and make sure I'm understanding this, and I'll obviously listen to the recording again. All the notes I take, if you see me type something and are like, that's not completely what I said, I just want everyone to know that I'll go back through the recording and add the details to make sure it's accurate. So Eugenia, I want to make sure what I'm understanding or what I'm hearing you say is that per diem should be part of the entire rate that they charge. And if they want to have something, they would need to apply for a waiver in order to charge per diem outside of that. Is that, or is that, I'm sorry if I'm misunderstanding, but is that what you're saying? Maybe we lost Eugenia.
Oh,
Yeah,
interesting.
you're unmuted.
Yeah, I think you did lose me briefly. Sorry, I couldn't hear that, Shelley. I
Oh,
have an
okay.
unstable internet, which is why I'm also off camera, so I apologize for that.
Okay, no problem. What I was saying is I was trying to make sure that I'm understanding what you're saying. So what you're saying is like a per diem stipend would be within the max rate. And if they wanted to charge a per diem stipend outside of the max rate, they would apply for that in a waiver. Is that what you're stating?
No, it would be you're only able to charge the max rate, right? That's the maximum rate that bill rate that someone can charge, and that's something that is being set by OHA. However, let's say there's a situation, maybe I am in a more rural or frontier area, and I'm having a really hard time fitting within that max rate, right? And let's say, hey, I've got someone coming in from maybe Idaho, and they're going to need some living expenses. And so that seems to be something that can be, again, here's a max rate. You can't operate, but I can't, bring someone in at the max rate. I've got to go above it. I would think that those parties could say, hey, OHA, we're coming to you for a non-emergency waiver because we cannot operate, we can't bring this person in at the max rates. We've got to go above it and offer something above and below. Maybe it's an hour, an hourly amount that they've agreed to that, reflects the per diem stipend.
Okay, so in relation to the per diem, though, you're stating that it should be included in the max rate. And
I
if
thi-
they need more
I
to go over, it should
I think
not.
I've captured it,
Yeah, okay.
Shelley. I'm following. I think it's a little bit different than
Okay.
that, but instead, essentially building the non-emergency waiver mechanism to support stipends as a mechanism to go over the maximum rates, as
Gotcha.
opposed to just like a carve out.
Correct, Joe.
Thanks, Eugenia. That's really helpful.
Thank you.
Yeah,
Sorry.
because I think otherwise, I think that there may be some concerns around like we're adding, another per diem stipend, and you're trying to build another kind of quote unquote rate. And if we are building quote unquote a per diem stipend rate, I would probably recommend making sure that we have some type of parameters because I know from other states sometimes a nurse is a traveling nurse, but they literally are traveling down the street to a hospital or a facility that they don't want to, they were an employee at one point in time, but now they become a temporary staffing agency and they're quote unquote traveling to that same location. So I would want to make sure that we are very mindful of when that per diem stipend is triggered. And if we're looking at the GSA, rates, do we look at their way of defining, like, are you in travel status and away from your place of residence for more than 12 hours and you're duplicating your living expenses, right? Because we just want to be mindful that this isn't a vehicle to inflate rates.
All
Got
right.
it.
Thanks, Eugenia. Let's move to Troy. You are welcome to unmute, Troy.
Thank you. I'm just curious to know what triggered this sort of desire to break out rate into these three separate definitions. And I think sort of underlying that question is I don't see a significant impact to the max rates. Using these new definitions, I'm assuming the formula doesn't change based on how these definitions are employed. But I'm just curious to know, like, what problem are we solving, or what issue has arisen that triggered the need to break these into three separate definitions?
All right, I can go ahead and jump in on that one. You want me to do that, Rodney?
Yes.
So, Troy, what we're really trying to do is get to a point of clarification for our data requests. So when we ask for data from the temporary staffing agencies, we ask them for their wage rate as well as their bill rate. And we planning to ask them about stipends. And what we're trying to do is actually capture a shared understanding of what should go into that reporting. We received a large number of questions and some back and forth related to how are you guys defining this? So we thought it best for us to be able to point to a rule definition for us to be able to support our data request. It doesn't change the methodology or the way that we build the maximum rates in any way.
Okay. That's especially interesting because of the point that Eugenia raised earlier about how bill rate sort of deviates from the common understanding between, the staffing agencies and the client
Yeah,
the
and we can
patterns.
definitely clean up bill rate definition as well to make sure it supports the way that the industry's actually functioning. Our intent here is to not be disruptive, but to provide the clarification we need so we get uniform information from the TSAs.
Look at it. Thank you.
All right, Rodney, in the interest of time, I think we should move on to the next section. And if folks have additional feedback for that one, if you could please provide it via the feedback form or in the chat, that would be great.
Got it. Thank you. So moving on to, you can't see that, subsection 28. Section, I can't see the screen.
4090399.
You can't see the screen, Rodney?
No, that's me on my end.
20.
Yes, there we go. Thank you. All right, so for 409-039-0020, scope and applicability exceptions. Here we have the terminology alignment only, bill rate replaces rate here, and no other changes are reflected in this section. Moving forward to 409-039-0030, health professions personnel covered. Again, the call out here is the terminology alignment for subsections 1 and 2. Maximum bill rate replaces rate here, and there are no other changes here. 0040, maximum rates for hospitals or facility. Calling out subsections 1, 2, 3, terminology updated to bill rates, also deletes the phrase and will be published on the program website from subsection 3. The following is an addition introducing the multi-year effective date framework. For calendar year 2025, maximum rates are effective started January 1st, 2025, and applied to rates negotiated on or after January 1st, 2025. For calendar year 2026, maximum rates are effective starting January 1st, 2026, and applied to rates negotiated on or after January 1st, 2026. For calendar year 2027 and later, maximum rates will be published in the fourth quarter of the prior year and are effective January 1st of each year for service dates on or after January 1st.
We have a question again from Eugenia, or a comment, maybe hand raise is more appropriate. There you go, Eugenia.
Thank you. I am wondering, I know the intent of the statute was for OHA to set maximum bill rates that can be charged every year, but I think by phrasing it this way, we may be inadvertently adding administrative costs and burdens on providers by essentially requiring them to renegotiate those contracts every year. It seems that if there's a multi-year contract with a vendor, let's say they want to just have a longer relationship, and then let's say it's a 2-year contract, but those rates drop between those 2 years, you could end up having someone who's engaged in a particular year at a higher rate or a lower rate than what is outlined in statute or by rule. And I'm wondering if just to kind of like facilitate things, I think the rate should be applied to any personnel that are engaged while those maximum rates are in effect. So if they're engaged after January 1st of 2026, whatever the bill rate is, the maximum bill rate is, that's the bill rate that should apply to that personnel being engaged that year. I don't know that necessarily we want to tie it to a contract negotiation.
And so, Eugenia, when you use the term engaged, can you clarify for us what that would be?
It's the person that like is assigned, right? Like, let's say I have a contract and I have a contract with ABC Staffing Agency. It's a 2-year contract. I enter into it on January 1st of 2025. But let's say I'm in 2026, February 2026. I'm reaching out and saying I need staff today. They send someone over. It's whatever rate that is in effect at that time. That's the rate. That's a maximum bill rate that should apply to that personnel.
Okay, that's really helpful. And what we can look at is kind of tweaking our language. I think or not, I think that's exactly what we're looking for, is to get to a point where essentially we're outside of this realm where folks can say, kind of grandfathered into old rates that are still effective for the foreseeable future. We've heard about some long-term contracts that exist for folks, so making sure that we kind of close that and wind up in a space where once the rates are happening within that year, the folks are adhering to them within that calendar year. So we'll definitely clean up that language, and your feedback on that form will be helpful in getting there.
Okay.
So here I'm going to call out the table for 2026 maximum rates, bill rates, sorry, rates.
I'm going to ask Rodney to pause for an extra second here to see if folks have any feedback or comments about the maximum rates. As we've engaged with different groups impacted by this legislation, we've heard different things, so definitely want to make sure that we uplift the voices of the hospitals and facilities in relation to where these rates sit, if possible. And of course, if that feedback's better done via the form, we will receive it that way as well.
We have a hand from Troy.
Alrighty. Just curious to hear your perspective on, I see some key rates, like the RNs in the hospital setting, as well as in other facilities, that is. Those rates were reduced. I think it's particularly interesting for us as Oregon leads the pack for costs of living adjustment with the highest nurse rates in the country. And those rates have only gone up for our hospital members with a new staffing law that was voted on by the legislature in the 23 session. I know that the BLS data serves as a sort of starting point or foundation for the rate making process. I'm curious to know whether the BLS averages unnecessarily weigh down the rates because they don't necessarily reflect the higher cost of staffing a hospital on the West Coast, because this isn't just an Oregon thing. This is Washington, California as well. So just curious to get some feedback on that.
Yeah, so certainly can't speak to the necessity of the rates going down. I think I heard you say unnecessarily reducing the rates. So I think that for us, the way we view it is that we have a mandate by the legislation to follow BLS OED data, and that it bears a reasonable relationship to that. We have the rate methodology published online that shows the additional factors we use to uplift the pay, to make adjustments from that permanent wage, temporary wage, looking at the difference between those, adding a factor to inflate the temporary wages. In relationship to the RNs in hospitals, we also included another factor for them, understanding that the specialization required for RNs working in hospitals often requires additional resources to be able to support them. So in particular, the RNs in hospitals had an addition that was put onto their rate to support the specialty necessary for working in hospitals. What we've seen is a reduction in the wages in the BLS and OED data that the legislation ties us to. So that starting point was reduced this year because we didn't choose to increase the agency maximum margin. What that resulted in is slightly decreased rates in a number of these areas. As we follow that OED and BLS data, if we see them move up, we'll follow the data, see rates kind of fluctuate up. If we see them move down, we'll follow the data in the same way that we believe is required of us as good stewards of taxpayer dollars and the folks operationalizing this legislation. There is also built into the OED data a trend forward for, I don't believe that they call it cost of living, but inflation.
One additional question. And I looked at your sort of formula calculation. And fortunately, I was not a math student in college. But anyway, I think my concern is that the BLS data as a starting point, because I thought the legislation required the use of OED data. I don't remember a reference to the Federal Bureau. Um, I guess what I'm getting at is none of my members are experiencing a reduction in the cost of nurse staffing. So how is that showing up in the data that you're using to calculate the rates?
Yeah, so trying to make sure that I answer this in the most diplomatic way possible. I think what the data showed us is that the wage rate that folks are receiving has decreased from in the 2020, 2021, 2022 era of post-COVID inflated rates and wages. What the cost that a hospital or facility may be paying could also be influenced by the amount of agency margin that was being charged to hospitals and facilities prior to this legislation existing. So I think we see a slight discrepancy in the way that things have happened in the past as to how we are working towards with the legislation, mostly in relation to the margin that in my opinion, and I'll state this in the public forum, and hopefully I'm not supposed to say this, but the exorbitant costs or the high costs were mostly related to the large margins being taken by the TSAs and not the wages received by the workers. So the actual wages that temp and permanent receive feed into that BLS and OED data. So we utilized a technical advisory group made up of economists, actuaries, and other experts from the state. And they gave us guidance on how to utilize that OED and BLS data and helped us understand how the OED data is essentially an output of the BLS data and how they interact with each other. So because the legislation ties it to us, that'll always be our starting point. And frankly, what we saw is the only way that these rates wouldn't decrease is if we inflated the margin because the wage rates are built using that BLS data source. I hope that answers your question. And
I think so. And if I'm understanding, if I'm understanding correctly, what I'm hearing is that the reductions here are accounted for in a reduction in the margin.
It's because the margin was maintained and the BLS and OED data is built over a 3-year span.
Okay.
So it's not just like one point in time. So when we grab OED data, it's not 2024 is the only thing being looked at. So we're still spanning back to 2021.
Okay.
So during COVID, likely saw the wages increase for folks who are serving during COVID. As we get further away from that, the wage rate decreasing and the margin stays the same is what results. So it's being driven down by the wage rate. Okay. That being said, if a TSA and a hospital and facility want to pay a worker above the wage rate and they choose to tap into their margin, there's still the opportunity for those negotiations to happen where folks are paid over that wage rate, but it requires the TSA to make the agreement that they don't take the full 34.2% margin.
Thank you.
Rodney, did you want to jump in, or there's one comment in the chat that we can also address? Oh, cool. Okay. Sandra says in the chat, there are odd numbers. Was this an average of those participants? Is there a reason to include since?
Yeah, I think we made a programmatic decision not to just like round up or round down to solid dollar figures. So that was, I think I can take ownership for making a decision as the program manager to use cents. And it's not an average of those from participants, but the rate methodology is rather complex and can be found online. Sandra, if you'd like some more information, I think you could visit the website. Either that or send us an email and we can break down a little bit of the rate methodology for you so that you can see the mechanisms that are used to result in those numbers.
Thank you, Joe. Before we continue, I just also want to add to that again, the calculation don't always land on an even number. So you'll see that in some of the numbers that are reflected here. And also wanted to not recap, but touch on, I was muted on Troy's comment about the BLS data, and you are correct. So no, the bill itself doesn't reference the BLS data, but of course, the program HB 2665 gives the OHA the authority to set maximum rates and the margin cap, but it doesn't dictate the data source, right? And the program chose BLS and the OED wage data as a foundation during the rulemaking because it was standardized, transparent. So again, thank you for that comment. We are definitely going to log that in. Are we free to move on to the next section?
Based on time, we probably should, Rodney, and if folks can use the form for any additional feedback or the chat, we'd appreciate it.
Got it. And we are moving to 409-039-0050. Waivers to charge more than the maximum rates here in subsection 1 and 2. The terminology has been updated to bill rates. And in subsection 3, the following is an addition, which is waivers approved by the authority permit a temporary staffing agency to exceed the maximum bill rate for a certain period of time. Maximum agency margin must remain at the percentage specified in OAR 409-039-0040 subsection 3. I'll briefly pause right there.
We have a hand from Eugenia.
I think on that subsection 3, right now the language says that the maximum agency margin must remain at the percentage specified, but I think maybe the intent is that it cannot exceed it because they can take less based on what you were just saying, Joe, right? Yeah.
Good catch, Eugenia. Thank you.
409-039-0060 application process and review of emergency waiver request. In subsection 1, 4, and 5, the terminology updated to bill rates. 409-039-0070 application process and review of non-emergency waiver requests. Again, here terminology has been updated to bill rates. And moving on to 0090, annual evaluation of maximum rates. The subsection 3, the following is an addition. The authority will refer violations of the maximum bill rates, maximum agency margin, and or waivers to the authority's health licensing office for investigation and disciplinary action. In 409-039-0100 data requests, here in subsection 1, we have the terminology updated to bill rates as well.
Rodney, we have a hand from Troy.
Oh, okay.
Just curious to know, this is just coming out of a place of curiosity. Does ODHS not have like some certain enforcement authority that handing this over to HLO sort of cures?
I think what we just recognized here is that there's a portion of House Bill 2665 where the health licensing office was within the Oregon Health Authority is the folks that have the enforcement arm of this. So what we were trying to do is just state and clarify that for the purposes of the data request, when we're receiving folks from data, we want to make sure that they're clear as to what the data is being used for. So the mechanism hasn't changed, rather us trying to create the clarification that it's OHA's health licensing office that actually does the investigations and disciplinary action related to that like fee that can be charged if folks exceed the maximum rates without a waiver.
In accordance with statute, though.
Yeah.
Okay.
Thank you for that, Troy. Moving on to 000120, information sharing and use of data. Here we have the terminology alignment and clarification replaces OHA's with the authority's health licensing office.
Great job, Rodney. Appreciate you walking through those. I'm going to give a minute pause here to see if any folks have any additional questions before we wrap things up, and we can revisit any portion of the rules if folks would like. Keeping in mind, though, that I understand that some people might want to submit feedback via writing and don't want to raise their hand in a meeting, which is perfectly fine. All right, I'm reminding myself of the facilitation training to wait a second longer than it feels comfortable for feedback. So I think I've done that. We're going to go ahead and wrap things up for the day. I really appreciate this. Y'all provided us some really useful feedback. We appreciate the questions. We are fully committed as a program to continuing to engage with folks who are impacted by this legislation, making adjustments and tweaks as necessary to support those who have to adhere to the regulations we set forth. So we really appreciate the collaborative relationship we've been able to build with y'all and look forward to continuing it for the foreseeable future as we operationalize this legislation. Thanks again for your time. You guys have a great day.
And just a note for everyone, the link is in the chat for the smart sheet. I think maybe Joe said that, but just reminding everyone.
Thanks, Shelley.
Great. Thanks all.